Well, what we have to understand is that healthcare is extremely important for people on an individual basis. Health is, extremely important. When we want our family to be healthy, we want our parents to be healthy, and we want to be healthy as well. And we want to be sure that there's a system in place that will respond to those needs and provide us with the best care possible and the best, healthcare outcomes as possible. So it is a sensitive issue. It is something important for everyone. And when we look at in terms of public investment, it's also the major investments of state governments, national governments around the world. And therefore it's always the focus of attention in terms of ensuring that we ensure the best outcomes at the system perspective. So it is an intricate part of democracy to really provide information to the population, to Parliament and various stakeholders about the performance of the healthcare system because of its importance for people and its importance in terms of investment of public funds. So sometimes the good news, sometimes the bad news will make headlines and it will be captured at the local level depending on the nature of the information. And that's something that we understand at the Bureau of Health Information. We try to provide always more and more information, more detailed information and granular information at the local level so that people can go beyond the headlines and really try to understand what is this report all about? What is this variation in performance all about? And what is it that we could do about it? So that people can engage in a meaningful conversation with the media, but also in a meaningful conversation within communities and clinical settings to try to diagnose what are the issues, what are the things that are going well, and really make the best decisions in terms of improvements. So I think that we have to accept that sometimes there are sensitive issues that will be picked up. It's sometimes more difficult to get the good news picked up as much as the bad news. We all know about that. But in the end, it's all part of a public debate, and it's all part of a society really reflecting on a very important part of the public sector delivery, and we have to accept that it's important for people. And it's all part of the transparency agenda that many countries are establishing at the moment.